By gum, I am bleeding from my bum. What should I do? Well, I'm Andy Knox, GP and Director for Health and Wellbeing in Morecambe Bay, and I'm going to talk to you exactly about what you should do if you are in fact bleeding from your bottom. First thing is, don't panic. Okay? The vast majority of times that people bleed from their backside is because they've got piles or hemorrhoids, which is basically varicose veins around your butthole, around your anus. Often they're quite painful, but not always. They can be when they swell up. But you often feel them as they feel like a bit like a cluster of grapes around your bumhole. But sometimes they're inside. And usually if they bleed, it's because they've swollen up a bit too much, possibly through straining when you've been a bit constipated. And you'll either get a bit of fresh red blood when you wipe your bum, or you'll get a burst of kind of red blood into the toilet. Now that won't normally last for more than a few days, certainly the bleeding part. And it's easy to treat and look after yourself. One thing that you can do, especially if it's sore and they're swollen, is just get some frozen peas, wrap them in in a tea towel or something like that, and just wedge them up your butt crack. It'll help shrink them down a bit. That will really help and relieve the pain. The other thing is go and see your pharmacist. Now remember, you don't have to announce to the whole pharmacy that you've got piles. You can ask for a private consultation with the pharmacist, and you can just tell them you've got piles, and they'll recommend some cream for you. Lots of different ones, Anisole, Sherry Proc, Ultra Proc, lots of different ones. And what you need to do is just rub that around your anus morning and night, and after every time that you take a poo. And also you can get some suppositories that you put up inside your bum, and they will shrink the piles down and help them to go away. Very occasionally you might end up needing surgery for them if they're very severe, but actually it's not that common. Now, if you're bleeding from your bum and you're getting diarrhea, and certainly if it's gone on more than a couple of weeks, you definitely need to come and get checked out by your nurse practitioner or your GP. Or if you're getting mucus or crampy pains or you're losing weight, those are signs that something more serious could be going on, and they're the kind of things that we would definitely want to check out. So you can see my other video about how to prepare for a rectal examination, but if you're bleeding for more than just a few days and it's mixed in with your poo, and you're also getting some mucus or some cramps or some diarrhea or some weight loss or pain, whatever, definitely come and let us have a look at you and get checked out. Don't be embarrassed about it. We're here to help. But remember, the vast majority of times it's piles or hemorrhoids. Try treating yourself by help from a pharmacist, but if there's some of the other stuff associated with it, come for an examination with your nurse practitioner or your GP.